Sort of good afternoon in the UK, good evening in Asia, and good morning in California. Joined today by Jyri Engeström, who has been one of the organizers of an incredible initiative to do a COVID testing of an entire community. That community is Bolinas, California. And you're joining us from outside the tents where the testing has been taking place?
That's right. We're here right next to the Bolinas fire station. I'll turn around and maybe those of you who can see this video can see there's a fire station in the background, and we got these, what you see here that looks almost like an encampment of like for some kind of wedding or festival, but in fact what they are or have most recently been used for are coronavirus testing stations. We just concluded 4 days of testing. In fact, we added a additional 5th day that just finished yesterday to reach some homebound and homeless people here in town. And so right now the tents are empty, but we've had almost 2,000 people pass through here and get tested over the last 4 days.
And what is the entire population of Bolinas?
That's a good question. This is an unincorporated town. The last census was done 10 years ago, and the population count was 1,680. We had almost 2,000 people get tested, and so there were some local area first responders, firefighters, healthcare workers also included in that. So I think we got pretty much 100% of the population, very close to that.
Amazing. And you've managed to do this at a time when national governments are challenged getting the testing. Here in the UK, the government has said they get 100,000 per day. They're still having trouble ramping that up. In the US, difficulty getting tests everywhere. First of all, how did you get the tests, and what tests are they?
Yeah, that's a great question. When Cyrus Harmon and another local Bolinas resident, started talking about this, we obviously assumed that there just weren't any tests available. That turned out not to be correct. It turned out we, in fact, had too many tests offered to us, which led us to run multiple tests on all of the samples that we collected. So this idea that there aren't tests available, we discovered was a complete fabrication. That's not at all the case. In fact, there's an overflow of tests, as well as lab capacity to process them. Our samples right now are being processed even as I speak at the Chan Zuckerberg Biolab at the UCSF campus, the University of California, San Francisco, about an hour south of here in the city in San Francisco. And it sounds like they have a lot of capacity there that's currently not being used.
So how did you get, where did you buy them from? Who did you buy them from?
So we're using 2 kinds of tests. Everybody who came through these tents here, it's a drive-through. They'd pull up in their car and a medical professional would swab them from the inside of their mouths as well as in their nose, kind of like you've probably seen in images of hospitals conducting testing around the world. So this is a test for active virus that then gets run in an RT-PCR machine, nucleic acid test, that really tells us if someone is infectious at the moment. So that's test number 1. We also collected blood samples from everybody using a finger prick, not a full blood draw, but it's a really quick finger prick. And we collected enough blood to be able to run multiple antibody tests. As you know, that, right now a lot of people are talking about, because there's questions around whether they would signal some sort of immunity for those people who've been exposed to the virus and then developed antibodies. Of course, that's right now an open question. Nobody knows. But from our perspective, it was important to do both types, both the active virus PCR test as well as a antibody test, blood test, in order to have the most reliability. We can cross-reference those against each other, and they tell us different things. So those are the 2 types of tests we did. We ended up using the RT-PCR, tests are pretty standard assays that you can pretty much, we even thought about initially about just making our own. Cyrus is a scientist, but it turned out that we could easily access those assays, and so that wasn't a problem for us. They were put together at the UCSF lab for us. We originally actually discussed running the tests in Los Angeles, which had another lab that offered to work with us. But in the trial run, we would have to FedEx overnight the test samples there. My sample got lost by FedEx, and I was like, I don't know if this is actually a good idea. So we ended up working with a local partner. And then regarding these antibody tests, now there's obviously hundreds of those right now already in the market, and there's a lot of questions around reliability.
Yes, exactly.
So it's important to differentiate between point of care kits that are really these at-home tests that are basically like a pregnancy test that'll give you a quick reading right on the spot, versus what tests we use, which are known as ELISA, ELISA. These are blood tests that essentially require you to run them in a lab. And that's what we ended up doing. We felt those were going to be more likely to be reliable. We're actually running two different types. UCSF just published a preprint, I think yesterday. There was an article in the New York Times. There's a group there that's been doing excellent work, basically cross-comparing over 100 different antibody tests against each other, because there are so many open questions about their validity in terms of specificity as well as sensitivity. A lot of the manufacturers quote really high numbers, 100% sensitivity, 100% specificity, whatever, but usually those are done with very small samples, and also not necessarily with, because usually, when they run the blood test, they will have access to COVID positive patients who are in the hospital and have taken, given blood in the hospital, and those cases are usually very severe, versus, as you know, most COVID cases are actually very, very mild. And so there's a little bit of uncertainty around some of the numbers that many of the manufacturers are representing as being very, very reliable, when in fact you then actually test them on various kinds of blood from people who had no symptoms or very mild symptoms, et cetera, et cetera. The story tends to be more nuanced. And so we opted for this. We're actually right now already communicating very quickly over text message to the population the RT-PCR test results. So these are the active virus test results, which are also urgent.
Have you got any of those results in yet?
I got mine, yes. I'm negative on the PCR test. And so I don't know if we've had any positives yet. Don't quote me on that, because they're just rolling in as I speak. We actually built the tech that the booking system and a computer systems team of engineers at Airbnb.
How did you get? When did this whole initiative start? How did you get word out? How did you source the tents? When did this all begin?
Yeah, these are actually wedding tents. They're normally used for weddings, and so we started about 3.5, 4 weeks ago, I think. It's been a crazy month. We basically, started reaching out to labs, figuring out if we should build our own tests. And then, basically very, very quickly, people just kind of threw themselves into it. And this entire volunteer organization, or an army of volunteers, just sort of, summoned itself from nowhere. And, basically put everything together. I threw up a GoFundMe campaign online in order to raise funds for this. A local entrepreneur, Mark Pincus, founder of Zynga, the gaming company that makes these casual games, was the first one who offered to donate. He said, look, if you start this for real, I'll match up to $100,000 of donations. And I said, wow, okay, that means we really don't have an excuse to not really do this now. So I guess I better get to work. And so Pincus art anchored, in a sense, that we ended up raising about $350,000 altogether to pay for this, which incidentally, so that paid for testing of the entire town. I think we had around somewhere between 1,800 and 1,900 people tested. I'm not really sure, because the numbers are still coming in, because we just finished testing some of these homebound people last night, which roughly equates to the cost of one coronavirus intensive care unit patient, by the way. So basically, I'm looking at it.
Testing the entire population of Bolinas, California costs as much as taking care of one coronavirus patient.
One patient, right? So if we say one ICU hospitalized, case in town, then hopefully that'll cover the cost that the donors, volunteer donors. I think we had 170 people, contribute money to the campaign. Most of the checks were 93% were, you know, contributions under $5,000. So most of them were very small. Like I said, Mark Pincus was by far the biggest check, but he ended up, having to, stand by his word and, donated the $100,000. So the rest are these small donations. So it ended up kind of emerging very quickly, just in the last few days, literally. And we've been sort of building it as we go.
What do you think you'll find by doing this 100% test? Do you think you'll be able to find anything interesting about the disease itself, the spreading of it? What is your intent with this?
Right. When we started, we were inspired by, I had read an article in The Guardian about this Italian village of V-O, which, and this was like, I don't know, 3-4 weeks ago, when northern Italy was getting hit really hard by coronavirus. And this town, which was roughly the size of our town, Bolinas, which incidentally people here call B-O. So it seemed like an uncanny resemblance. Well, they had tested the entire town, right? And it was the first time I heard this was even possible. And I think they discovered
this was the citizens of Vo were doing this.
Right. So there's a team of researchers who worked at the university there who ran it together with, I believe there was, locals involved. And so they tested everyone, isolated the positive cases, retested, and were able to essentially eradicate the virus from the small town. And at the time, as you might recall, Silicon Valley, this area, as well as New York, were just spiking. And so it looked like very quickly things could get really, really bad here, just like they were getting bad in Italy. And so originally, I think the impetus here was this town, I think the median age of the population is about 62. So basically, if you forgive me, it's a bunch of aging hippies whose idea of social distancing is to hug each other a little bit less. And so we were incredibly concerned about, frankly, 15% are below poverty line. The median household income here is around $50,000, which is way below the median for America in general. So this is not a rich, wealthy, well-to-do, population with good access to healthcare. There are a lot of people here who don't have healthcare insurance, which, as you know, is a big, big deal in America. If you don't have insurance, you can't get care. And so there are a lot of reasons why I was freaking out. I'm from Finland, which has universal healthcare, and I could see how much better off the population there was versus my own town over here. And so testing everyone seemed like the natural way to simply just at least get an idea of whether the virus was spreading in the community. I myself didn't know if I was asymptomatic and passing it on to people at risk without knowing that. And so that was the impetus. Now, what's happened since then is in California, the governor here, who's by the way, I think been very good with this, as well as the local, Bay Area mayors, yes. London Breed in San Francisco, and so on, instituted stay-at-home, shelter-at-home ordinances about a week before New York, which it seems like really cut the head off that impeding crisis that dramatically hit New York. And so we ended up kind of dodging the bullet. And right now in Bolinas, I'm not aware of a single confirmed COVID positive case yet, which, there are many in Marin. There's hundreds in this area, but in this little niche town here, there may be, but I'm not aware. And I thank, the governor and the mayors here for acting fast. But what's happened now is everybody's starting to think about getting back to work. In this dirt field here, we actually had to run this testing operation during the week. We originally wanted to do it during the weekend. And the reason we couldn't is because it is a food drive. Literally, if we had taken over the field and they wouldn't have been able to distribute food, there was a risk that some members of the population who are now unemployed because of Corona might starve. And so it's really, really, strong, this sense of urgency for people to be able to regain a source of income, basically return to work. And the antibody testing is now obviously what people look to for a possible answer in terms of information, at least, on whether the county, whether the state should begin then releasing some of these, pretty strong limits and restrictions on movement and just people's ability to go back to work. So that's really what we're addressing right now.
And what has been the reaction of the town, both official, unofficial, first responders, to this initiative?
We had overwhelming support. I think people just threw themselves into it. Like I said, the firemen, the firefighters from the fire station, the first responders behind us, have been, helping out. We had our command center there. Fire chief George Krakauer has become a good friend of mine now through this. I hope. At least I'm a huge fan. So there was this sense, I think, for a town like this, it became a unifying cause. Really, people could rally around it, and they saw that this could provide a way out. So, we're yet to see. We're going to have our town hall next week, where the UCSF doctors who are overseeing the study part of this will communicate the aggregate results to the community, and so there will be another maybe 2 or 3 weeks before we have the antibody results, because we want to take time to really run a couple different tests, ensure that we're providing people with reliable information about that, because it's such a fraught question right now, just regarding the test that we were talking about earlier. And so we're going to do this in 2 stages, where this next week, we're going to communicate the results of the RT-PCR tests for active infection, and then the nucleic acid tests. And then a couple weeks later, we'll follow up with information about the results of the antibody testing.
So what is your message to other communities who are looking around saying, wait a minute, why am I not getting tested? Here in the UK, the healthcare workers are not even getting tested. They're unable to get tests. What is your message to people who want to do it?
Yeah, I think, we were angry about that. One of Georgia's firefighters was down with COVID symptoms and couldn't go to work, and really kind of sick. And, he tried to get tested here in Marin and was turned down because he didn't meet the criteria. He hadn't had contact with a known COVID positive, and he hadn't traveled to Wuhan. And so I think that also catalyzed a little bit of maybe even this sense of social injustice. I would feel that way personally. I don't know if everybody else here, but in a sense, and I can feel that when I see and hear from people around the world who are in these similar situations right now, where they are sick, or their family member is sick, or someone who is a pillar in their society, is sick, and then they feel like they can't get tested. And so I feel like there's a clear solution out of this, which is testing capacity exists.
Yes.
The testing kits exist. These are all out there. They're available if you basically just start acting and seek them out. What were missing for us were things like nobody was doing this more mundane nuts and bolts part of this. I talked to the good people in the hospitals, the researchers, and even in the testing, the test manufacturers. They're in labs. They treat patients, or they are chemists. They aren't entrepreneurs who go out on a dirt field and figure out where to get wedding tents. The PPE, the personal protective equipment, that was another big deal. Like, oh, we can't possibly access any. You'll be taken away from hospitals. We sourced from local hardware stores. So there were painters, Tyvek protective suits that were, available. The hardware stores had them. There's the masks were donated by folks who had sourced 2 million of them from China. Originally, we thought we couldn't use them, but then the FDA here issued I think the next day we got him a order basically allowing for their use. There are these KN95 masks that we ended up using. The gloves were from restaurant suppliers. So we basically just scavenged the supply chain, and it turned out that all these items were readily available. The swabs that have been in short supply, we just used shorter swabs that don't go that far up the nose, which seems like the most recent research is suggesting is actually a much more reliable way of detecting the virus than the really, really ultra long NP swabs that have basically been part of the H1N1 flu protocol, and that just kind of got translated into COVID without anyone really even seeming to understand whether they're reliable or not. So, there's just a lot of odd, clear, common sense ways that you're just wondering, like, how the hell is this happening? Why aren't people just doing this? And I think that the message is, you should get your communities tested. You should demand it, and you can actually take action because it's not rocket science. You need a partner, like we ended up partnering with UCSF here, the infectious diseases team there, who had done studies of thousands of people in Africa and Uganda for AIDS, and knew, oh yeah, like, wait until you do this in Uganda, right? Like that's where you gotta, go guerrilla style. Like this is a walk in the park for them. So, it's totally possible for the price of literally like a single ICU unit. We could test this whole town. You can do it too. We're building a playbook for other towns, other communities.
So you're going to actually build out a toolkit.
Yeah, it's not that hard, honestly.
So
I encourage you to get to work.
Question from Beatrice Tarka, who's saying, if you isolate, as you have done, you don't have exposure, how viable is it for a city with large buildings, et cetera? And also, are you going to be tracking those, whether those who have the antibodies can get infected? What sort of tracking are you going to do of the population?
Right. We're the same team that was here yesterday is now continuing in San Francisco. And so we didn't stop, but once we finished in Bolinas, the same study moved over to the Mission District, if you've ever been to San Francisco, which is, a very Latinx heavy area of San Francisco. And they are currently testing people there now. So this is very much not limited to small towns. I think part of the exciting things here was to quickly replicate this in a big city, in a specific neighborhood. And I think that's what needs to happen is, town by town. In a big city, you go neighborhood by neighborhood, and you just get everyone tested.
And sorry, and I interrupted you about the playbook. The playbook is just something you're going to publish online. This is what you need. This is how you do it. These are the resources, and test away.
Yeah, I think so. I mean, you're talking about diagnostics that, you're not treating people, you're testing them. You're basically collecting samples from them. So, it's an intervention. It's a medical intervention, but it's doable pretty quickly, and it's pretty low risk when you are taking care to ensure that, like what we did was a drive-through setup with overseen by medical professionals. The actual testers were not volunteers. We paid them, we raised money, and they were licensed medical professionals who knew what they were doing. So you just basically volunteer, build the parts that you can, and then you raise money to hire people. Like in our case, they were licensed phlebotomists, so we didn't want to take away workforce from hospitals. But it turns out that there are other licensed professionals that actually work with hospitals already. Basically like an agency that had ample supply of qualified labor, and that's what we accessed. Regarding the question on the antibodies and reinfection and immunity, which I think is
and generally the follow-up in general. What sort of follow-up are you doing over time with the people who are either negative or positive, or if they get infected, et cetera?
Yeah. Right. Yeah. So what kind of follow-up we're doing? Well, it's interesting because it's still emerging, right? What we did was we partnered with the local health clinic, which actually you can kind of see in the background behind the fire station there. There's a little building right over there, which is the local health clinic. And the doctors there are set up a hotline, where people can call in if they have questions. Anybody who tests positive was going to get a phone call from the UCSF doctors explaining to them how to self-isolate, talk about possible treatment. And then, the county here has a team on standby that will do contact tracing, et cetera, kind of like the normal protocol. And so, at that point, it sort of shifts over to become the responsibility of the healthcare system. The county public health officer was just here on Thursday. He was excited. He said, I can't believe you're doing this. without taking any resources away from the normal functioning of the county. So I think that's where they come in, is in that follow-up if someone tests positive. For people who test negative, that's a really interesting question, because already community members are now receiving their results over text message, and they're going, well, I tested negative. Does that mean I can freely go, without a mask? Right now in Marin County here, in public spaces, if you go into a shop or you go out there, if I'm going to be wearing my mask immediately after I'm off this phone call because it's required here. And so, can I now not worry, right? And I think there the message is that, we haven't gotten the antibody test results yet. For the PCR test, it's pretty obvious. It means that you're not sick right now, you're not infectious, but that doesn't mean you can't catch the disease. So you should still continue to, follow the shelter-in-place ordinances, wear your mask, etc. If you test positive for antibodies, now that's a really interesting question, right? Because then you're probably going to feel a little bit more confident about yourself going out and, possibly not taking as many precautions. And currently, we're just not clear on whether that's, whether that's true or not. We don't know if you're actually immune. And so part of the reason why we're delaying by a few weeks communicating with the results is literally there's new science coming out day by day on this question. And so we thought it'd be better for us to actually take our time, run a few different tests, be extra careful about what we communicate to the community, because we don't want to end up realizing that we made a mistake and that somehow people threw away their masks and went back into having large sporting events or something, and a new wave would come around. So I don't know, that's kind of I think the worst case scenario.
So when will the results be? So everybody's already got their results for whether they are currently infected, right?
Those results are just rolling in. Not everybody's gotten them yet. I don't know what percentage has gotten them, but even as I speak, as they come in, the lab is basically has processed different batches for different days. Then they go into the system that sends out the individual secure results to each individual. And then we're expecting the aggregate results next week. And then I think on Friday, we're going to have this town hall Zoom for local population here to basically discuss the results, the aggregate results with the doctors, and talk about what that means for going forward.
And so you think you're going to, again, Beatrice is asking about tracking going forward. Are you going to track on 2, 3, 6 months later, since you've done a critical mass of the population so early on? It seems like from the research point of view, that could be very interesting.
Right. Yeah. So originally we were planning to do like a second round 2 weeks later of testing to see if the virus has spread. We're holding off on a decision about that until we discover if there are actually any positives in town. If there's 0, it's probably better to hold off and then see if there's, let's say we had a new wave of disease later on, maybe in the fall or whatever, then, that might be, from a public health perspective, a better moment to reorganize a second round of testing, right? And so we're now at this moment where we're still holding off on that decision until we see what the results from the first round are going to be. And so I think over time now what we're seeing is we're going to see more information about whether we can actually trust the antibody tests, if there is immunity, how long does it last, all those things. That'll enable us then to make informed decision about whether we partially open up to, let's say, only continue to isolate the elderly and at risk. Do we come up with some form of if you've tested positive for antibodies and you're clearly not infectious, that, we make some kind of gating where those you need to have, meet those requirements in order to be able to work in certain kinds of jobs, for instance, if you're taking care of the elderly. And so I think that these are the decisions that I hope that this kind of population-wide testing can actually inform, because frankly, we've been just running blind right now. We just don't know how widely the virus has even spread. So let's just get the basic information in order to begin, really being able to address those questions. Because I feel like we've just jumped to try to figure out the conclusions without bothering to do our homework about really knowing how widely spread the virus is in this society in general, not just in Bolinas, but in America in total. So,
Right.
and it's possible. That's what we're saying here. It's like, this can be done in a few weeks all over America and the UK. I'm from Finland. Like, I've just been talking to people in Finland about how to do this quickly there. I know how much it costs. I know exactly what the unit economics look like. I know how much labor it takes. I know how to do this. So, this can be replicated for sure. And so it's a fraction of the cost of the disease. And I think we owe it to each other to find out, so that we're not just making decisions based off of models that actually are not relying on reliable data, which is, I feel like, what's happening right now.
Right. So it's interesting to think about, how much we can extrapolate the learnings from Bolinas in terms of the what we discover in terms of infection rates. It's a relatively small location. How much it exchanges with the outside the community, and whether that can have an impact as well.
Yeah, I mean, this is one community, right? But it's in a fabric of communities that are all getting tested. Like I said, San Francisco is getting tested. Our friends in Stanford have been doing antibody testing down in Silicon Valley. And I feel like this is what's going on everywhere in the world right now. We have these pockets of people who are taking action. We need to share data with each other, provide it to policymakers so that they can make better decisions. And I think that it's possible for people who are excited about this and want to do this for their communities to actually join this movement and really get working on it, because it turns out that you can. That's kind of what I think Bolinas has proven, is that it's not that hard.
Well, it's a very positive message. We can take this on. We can organize it. We don't have to wait for large organizations or governments that might not be addressing the needs that we see in place to take action.
Yeah, I mean, look, we told Gavin Newsom, the governor, what we were gonna do, and we told the county. We found university researchers, who were willing to work with us, and basically everybody just kind of said, okay, sounds kind of good. But I think the problem wasn't that anybody was against it. It's just no one else was willing to take action. And I feel like that's the way it is elsewhere in the world as well. I don't see any downside in testing the population. The only downside, frankly, that I see, which is kind of nefarious, is if you think about the first responders, for instance, is, oh gosh, what happens if it turns out that 5% of them actually test positive? Are they now going to not be able to do their jobs? So you might end up in, these kinds of Bond villainous worries about whether you should actually restrict testing for someone like that, because you don't want to find out if they're positive. But I just find that argument to be ultimately immoral. We do need to find out, and if people are positive, regardless of what job they are in, they have the right to know and to take action and not spread the virus. So,
well, with knowledge, we're going to be able to react against it and take the action that's necessary.
Right.
Fabulous. Okay, Jyri, thank you so much. Any final thoughts on this? When is the toolkit available? Will you have the economic model available? Where and when will it be posted?
We have a website called bolinastesting.org. I don't know if I'm just going to do like a Medium post about this or what. Maybe we set up a better website. Right now, all the, the budgets, the amount of supplies you need, all that, the labor, the layouts of these kinds of testing stations, we've got all that. We just haven't put it together into a page that we've published yet. So it should be coming out hopefully in the next week or so. Yeah, just, I don't know, follow me on Twitter, I guess, at Jyri, or, ask Thomas. If you're interested in this, reach out, because I just want to make that clear. You can figure this out. It's not that hard.
Fabulous. Okay. Thank you so much, Jyri.
Cool. Thanks so much. Take care.